Hello, thank you for joining us again today. My name is Philip Williams. I am a pediatrician and associate medical director at Mariposa Community Health Center. It is always a pleasure to come today, one, to talk about health in our community. Just want to first give a huge thanks to Dr. Eladio Pededa, the Chief Medical Officer at Mariposa Community Health Center, and also our friends at We Love Nogales, at Edgardo, and others. And I think we can just jump straight into our session today. I am very excited to introduce one of my friends and colleagues, Emily Roth. She is a women's health nurse practitioner at Mariposa. Has been in this area for how long, Ms. Roth?
8.5 years. So
8.5 years.
Almost 9.
I love it. And then, I always like to start with what brought you here today. People always ask me, came from Chicago many years ago, and you came from the South?
I am from the Southeast, originally from Baton Rouge, Louisiana, with a Cajun French heritage. Moved my way slowly up to Tennessee, then Kentucky, and then got recruited for Mariposa 8.5 years ago.
I love that. So tell me, what initially led you to come to Mariposa and come to our area?
Well, to be honest, Dr. Eladio Pededa is one of the most warming individuals ever. He embraced our family. Mariposa was a lot smaller back then, and he knew the needs of my family. One being that education was important, and how he introduced Mariposa, welcomed my stepdaughter, my husband, and myself, and we knew it was a perfect fit. I don't know Spanish. I'm working on it. I'm probably moderate. But it was just the way he embraced us. Immediately, we felt like we were family of the community. Your
Spanish has improved a lot, though, since you came, I think, right?
That's I'm getting there.
If you want, we can do this session mainly in Spanish. Or
no, it's okay.
A little Spanglish, maybe?
There'll be a lot of Spanglish.
Got it. And then tell us a little bit about the OB/GYN department at Mariposa. I know there's currently 2 providers with one coming.
So right now it's myself. I'm a women's health nurse practitioner and a surgical first assist, and then my colleague, Dr. Taylor Jenkins. She's our OB/GYN and our surgeon on staff. And then we have a family nurse practitioner coming hopefully soon in September, who will be in addition to our staff. And then we, of course, have our laborists who are a part of us as well.
And tell me a little bit about your role at Mariposa.
Yeah. So I am typically only outpatient. I do clinical work, so I do obstetrics and gynecology throughout the entire spectrum. Also, being a surgical first assist, I assist my colleague Dr. Jenkins in all the major cases and C-sections. So I have the beauty of doing both roles.
And as you know, Mariposa has really served the women in our community for many, many years. And I'm very excited to talk about, I think for most people is going to be a new model to provide specifically prenatal care.
Yeah.
So we're going to talk a little bit about the centering model. And again, that's a word that until a few years ago I had actually never heard of. And you actually brought this idea to Mariposa. So thank you for doing that.
Yeah.
But let's just jump into it. Tell us a little bit about what is centering.
So centering in particular is a group prenatal model, or a group care of healthcare. There's a lot of these models out there. Centering is the oldest, the most researched, started in the 1990s. It's something that I got introduced to roughly 11 years ago during my internship in Nashville, Tennessee at Vanderbilt. And it's essentially bringing education-based care in a group setting. You still get your one-on-one care with the provider, but majority of it is led in a group setting to provide educational work. It's beautiful.
So how does that model differ from the traditional models of providing
So when we look at the traditional model, something that is very controversial right now because it just doesn't give a lot of one-on-one time with your provider. It's roughly 10 to 15 minutes. It's quick. Usually it involves a quick assessment, checking baby's heart tones, fundal heights, and then a lot of times the patient asks their questions. Usually it's 2 or 3, usually it's not very many questions, and there's very limited education because there's very limited time for that education. A lot of times that education is given through pamphlets, papers that we type up. Sometimes there's educational based sessions that can be in the community or at that hospital if it's more in a city area rather than rural community. They have more of those capabilities of education. In comparison to the centering model, it's 90 minutes to 2 hours. It seems like it's a really long session, but the first amount of the time is spent with the clinician, and then the rest is based on a topic based on when those women are based on their gestational age. So it's really relevant to what they're experiencing at that time.
So walk me through what a typical session would look like.
Yeah.
I'm a pregnant mom. I come to you. I schedule my appointment.
Absolutely.
What exactly does that look like?
So when a pregnant mom first comes in to their centering group, it's roughly 8 to 10, maybe a little bit more women of similar gestational age, similar due dates. They can bring their support individual, so it can be their husband, their friend, or their spouse. And for that first 30 minutes to an hour, they're checking their vitals. They do it on their own, and they collect it on their own in their book with the help of the co-facilitator, which is a medical assistant. And then the facilitator, which is the provider, is doing one-on-one time with each patient, doing the fundal heights, doing the fetal heart tones. And then when the clinician sees all the patients and they're done, it'll go back to the group session where they will discuss the topic of the day, whether it be breastfeeding initiative, common symptoms in pregnancy, parenting skills. There's a whole allotted book that takes a stepwise process on each topic through the gestational and through the pregnancy.
And are there options? Let's say that I am a mom that really wants the traditional model of OB/GYN care. Is that an option, or how are people selected for this model versus?
So when a mom comes in for their prenatal sign-up to basically establish care with us for that pregnancy, they're essentially offered the centering prenatal model, and they can opt out to go back to the traditional model. Because obviously it won't be fit for every woman, whether it be that they have a lot of children, that they just can't get to the meetings, whether those time slots don't meet their needs. They really don't have the 2 hours because they have a job where it doesn't allow that significant time off. So there is both models still available.
I love that it really does give a large amount of time devoted to education. What are some of the questions that you commonly hear from let's say new pregnant moms in terms of what to expect? And
a lot of the questions that we receive is related to what are safe medications that moms can take, appropriate nutrition, what is appropriate weight gain in pregnancy, can they exercise, and which appropriate exercise that they can do. Those are some of our most common questions amongst common symptoms of pregnancy.
And you mentioned some of the roles. You mentioned the role of the medical assistant. You mentioned the role of the provider. What are other people that may be involved in that medical visit? Yeah,
so majority of it's going to be that facilitator, which is the provider, and the medical assistant, which is the co-facilitator. That is the two major roles. Behind the scenes, obviously, there's an abundant amount of roles going on. There's the scheduling process. That's one of the big pieces of this group care is how do we schedule. So our scheduling group comes into play with this, with our operational side. Also the coding and how do we bill this. Right now it's really complex. This model's been out for a while now, a couple decades, but we're still struggling with how to bill this and how to get appropriately reimbursed. In terms of Arizona, they're still working on getting that reimbursed fully. It's still reimbursable, but they're struggling a little bit on the coding side with that. So we're still working on that. So there's a lot of components, not just the clinical side, but behind the scenes administration-wise.
I think one of the questions from our viewers could be, I'm a pregnant mom. I come to essentially a group. How much of the care is still individualized, and how do those individual assessments work? Yeah.
So like stated before, you still have almost the same amount of time you have one-on-one with that clinician. It's in a private space, so you still have that private ability to have that conversation, ask your questions that you don't want to be amongst the group. And we do the exact same thing we would do in a traditional model with checking heart tones, ordering your labs, answering your questions. If there's a more significant question that needs a lot more time, like a symptom that needs to be evaluated, like let's say vaginal discharge or a concern, when the entire group session is over, we bring that mom individually to the side to another actual exam room, and we do that assessment. So you still have that ability to have that examination or that specific need addressed.
This will be, new model here for Santa Cruz County, but you mentioned that you were exposed to it many years ago. What feedback have you heard from patients in terms of the centering model?
Oh my gosh. Majority of these moms absolutely love this model. And that is across the spectrum of different ethnicities and nationalities. In Nashville, Tennessee, we have an Ethiopian population amongst Hispanic population, and we ran these with the specific groups and their nationality. And a lot of them bonded with these women and carried their relationship with these women past the group sessions. They rooted each other on in their pregnancies, their deliveries. They called each other, checked on each other. They really thrived on creating a community amongst each other. And so you really get a sense of how they end up loving each other in the end of the group sessions.
I really love that. As you know, I have a 3-month-old granddaughter, and I think even for my own daughter, the opportunity for community, the opportunity to really connect, I think is. I know that there's been, research in terms of the centering model for many years. What does the research show in terms of outcomes and in terms of some of the benefits?
Yeah. So the major benefits to this type of model, specifically centering, has been the most researched, the model that we're using. It shows that it increases breastfeeding initiation and continuation. It also shows that it decreases NICU admissions and low, birth weights amongst use of long-term reversible contraceptive options for women. Very low maternal mental health conditions in women because they are empowered to have a group and build a community. There are so many benefits, especially women who do this model because they understand the common symptoms of pregnancy. They enter the hospital more active labor with more cervical dilation further in their delivery process. And so it actually decreases the C-section rates amongst these moms.
I love that. I think, as pediatricians, we really try to focus on health literacy. As you know, in PEDS visits, we do lots of health education. Yeah. I think this is just a total extension of that. I really love that. Yep. What about some of the challenges? We talked about a lot of the benefits, and it seems like that there are many. What are some of the challenges you think in terms of this model?
The biggest challenges to implementing this model comes in one, educating the community to not be scared of this model. Really putting out there the benefits so that everybody knows about what we can do and how women can thrive. That's the biggest. So that's what we're here today doing. Some other challenges have to do with scheduling. In the background, we talked about, coding and billing this visit. There has been a lot of administrative work behind the scenes on getting this up and running. It's been almost a year that we've been working behind the scenes, educating our staff, getting their buy-in, because they're so used to the traditional model, they can't see how this would benefit, and so that's been really challenging. And then also educating our facilitators and co-facilitators. It took a lot of time away from clinic, almost 3 sessions of 4 hours of walking away from clinic to educate ourselves on how to do this in informed and educational-based care.
Mm-hmm. What about dads? Are dads also included in the process, in the model?
Dads can come to the sessions. The pregnant mom can have one support individual at the sessions. So dads are more than welcome to come in and support their spouse or their partner through this model and through those sessions and be a part of it.
And I could see that, some of the moms may want to discuss very sensitive topics, topics that may traditionally really they only want to ask their provider one-on-one. It could have embarrassment. It could, again, just be sensitive.
Absolutely.
How are sensitive topics addressed in this model?
So one of the big things that we're taught as facilitators and co-facilitators is how to address these really special topics, really heavy topics. So at the very beginning, on the first session of centering, we build a groundwork and the group actually establishes these rules, essentially, of how the group is going to interact with each other in order to build trust amongst each other. And then the facilitators and co-facilitators go through trauma-informed care as well. They go through training for that. And then there's always a debriefing at the end so that we feel safe amongst each other having these discussions. Obviously, if something is super sensitive, that one-on-one conversation can be had with the facilitator behind the scenes in their one-on-one time. If it seems to be a topic that's really brought up amongst multiple women, sometimes we will address it in a blanket fashion, so it's not to isolate that individual. And then also, we can also provide resources as a group for different needs if it's brought up.
You mentioned a little bit about training, specifically for the medical providers, for the medical assistants. Is there extra specific training that you receive in order to learn this model?
100%. The success of this model and the consistency of this model comes from training. We receive, because it's a very clear-cut model of how it wants to be run, with essentially introducing a topic and how to lead the discussion, so that it's not a dry session where no one's wanting to participate. And participation is voluntary. No one has to participate. They can always just be there to listen to each other in the conversations. But yes, we go through a pretty rigorous training for multiple days. And I'm going to be honest, it's probably one of the best trainings I've done. Usually, as a healthcare provider, a lot of the education we receive or the updates in medicine is very clear and dry. But this one was more of a group setting, though we were in different parts of the United States coming together to be educated on this. I'm going to be honest, even though we did it over Zoom, we bonded with each and every individual. And so we actually all still have each other's names and phone numbers and still, discuss things via text message. So we bonded even just by doing it over Zoom across the nation. It was beautiful.
I love that. Do you think that this model is going to really spread? Again, it seems so innovative. It seems like such a benefit to moms. Have you seen the spread of this model, or what do you think it will happen in terms of the future of this model?
I'm hoping that this model will thrive in this community, because this community really thrives on each other. They really rely on the bond of one another in the community. My hope, though, is as we further and get more buy-in from the community, that we can have groups of similar ages. So our teens, because we have a high teen pregnancy rate in this community, that they can have their own groups so they feel comfortable expressing how they feel or their fears. Mothers of advanced maternal age, over than 35 and 40, they feel comfortable expressing how difficult pregnancy is, or waiting to have a baby so late in life. They can express and empower each other. My also hope is that this model of group healthcare goes to other departments. Centering doesn't all just go to prenatal care, it goes to pediatrics. There's a centering parenting model where they discuss developmental milestones, immunizations, and also parenting skills. And so it's the child's first 2 years of life. And sometimes it's beautiful because it can go to this, this prenatal model straight into the parenting after birth, and the same groups can stay together.
That sounds like a great project. I think we should take that on,
Yes.
right? I know. We're not busy enough. We should start this, right?
Not at all.
I love it.
Yeah.
So in terms of next steps, I'm a mom. I'm going to, I just found out I'm pregnant. In terms of scheduling, in terms of making appointments, in terms of timelines, where do we stand?
Yeah. So we're still in the stages of implementation, which is very difficult. We have right now, goal date for going live, possibly in October. Right now, one of our biggest difficulties is spacing. We're soon to be going to a different facility. We're hoping where we'll have an actual centering room. But we're also doing a survey for moms right now to figure out what is the best time that moms are available, whether it be mornings or afternoon, because there's only 2 facilitators, so we're going to try to divide, one have morning, one afternoon, so that there are options for moms. So right now we're still in the stages of, the facilitators have been educated, but we just need to put it on the scheduling process. As we get moms who are due or are expected to start their pregnancy in October or September, we will start offering the moms the centering option.
And if a mom wanted to learn more about this model, I assume that there's resources online, or how would they learn more?
To learn more, they can call the Mariposa OBGYN department as of right now. Some of our prenatal clerks can give more information. There's also a beautiful Centering Health Institute website that shows the model and all of its benefits.
I am very excited about this model. Again, I think it's going to be a game changer for our community. I think it's going to be such a big benefit. You really mentioned a couple things. You mentioned health literacy. You mentioned empowering people in our community. You mentioned connection. And I think that this really accomplishes all 3 of those. So absolutely love it. Any final thoughts? Anything else that you want to share with our
No,
viewers?
I'm just excited to hopefully finally get this started. I've mentioned this model for that past almost 8.5 years now when I first started, of wanting to achieve getting to this point. And I think it was once I was able to take over as head of department that I could really sit down and throw out the model to you guys and ask for your buy-in. I'm excited for the community to experience it. I know some individuals in the community have already experienced it in Tucson at El Rio, because they do use this form of prenatal care, or they used to at least. So I'm just super excited.
I also am very excited, and again, just want to thank you for taking time today to discuss. For any of our viewers, if you would like to make an appointment with any of our medical providers, please call Mariposa 520-281-1550. We're happy to schedule appointments both in OBGYN and pediatrics and adult medicine and in behavioral health. We are always here to serve our community. Again, thank you so much.
Thank you.
Centering, such an exciting model, and I'm very excited as we welcome this to our community.
Yes.
Thank you so much.
Thank
and
you.
then I hope that you will join us for our next session. Thank you all.